Fertility refers basically to ability to have a baby. Being related to sexuality and the cultural norms around, it becomes uncomfortable for some people to talk about it. But subfertility in its definition would be that a couple have not been able to get pregnant or have a baby after a defined period of time. Generally, if a couple have been trying for a baby for about a year and they haven't conceived, then it's very helpful that they seek medical help. At FED, we look at a couple and try to demystify this notion that to not get pregnant is one person's fault. In fact, it's not true, because you have to have ovulation and normal sperm, and the two have to meet in some ways. So the tubes are also fallopian tubes in the woman need to be open, and for the egg and the sperm to meet, there need to be intercourse that happens regularly. There are other causes. For instance, if you've had treatment for conditions like cancer that could affect fertility directly, you wouldn't want to wait a year before you see a doctor. If a man has had a form of testicular surgery in the past and they haven't got pregnant, or they are thinking about getting pregnant, it might be useful to see a doctor to make sure things are fine before you wait for a whole 12 months. We establish different types of causes of subfertility, but there are 3 or 4 broad areas that are categorized. So we look at evidence of ovulation in the woman, and if you are having regular periods, it's more likely that you're actually releasing an egg. However, we can do a test called progesterone, which is basically done 7 days before your period is due, so we can establish if ovulation is happening. The other large category of causes would be related to how the tubes work, and the tubes could be blocked from a variety of causes, commonly infection or scarring. And the test that we would do to check this is called hycosi, which is a special ultrasound scan that looks at the uterus and the ovaries just to make sure there are also no fibroids or cysts. And then we introduce a special dye that will outline the lining of the womb as well as the tubes. And lastly, we look at the sperm count on the semen analysis, and there are different parameters, but generally if we're able to see a certain number of sperm that are moving around, then we know there might be no problem. But if the number is low or the motility is low, then there could be a problem. And there would be about perhaps 3 in 10 couples who come through and there is no identified cause completely. We call that unexplained subfertility. And this also is a group where we might find conditions like endometriosis with mild forms that are lumped together as unexplained subfertility.